Welcome to the Functional Nurse Podcast, where we explore how nurses are transforming healthcare through functional medicine and nurse-led innovation. I'm your host, Brigitte Sager, founder of the Institute for Functional Nursing. Here, we're reclaiming our role as healers and leaders, one root cause conversation at a time. Hello, and welcome to this episode of the Functional Nurse Podcast. My name is Brigitte Sager, and I'm your host. And today we are going to explore a topic that I have been getting questions about for years from nurses and nurse practitioners. I get a lot of folks reaching out, and in particular, my students asking for advice on next steps for their career and what might be best for them advancing their career. I will get questions about whether nurses should go back to school at all, if they have an associate's and they're thinking of a bachelor's degree, if they are thinking about getting a master's versus a DNP or a PhD and the difference between those, and whether school is even the thing that they're really getting pulled to do in the first place. So I've had this on my list as a potential episode topic for a long time, and now is the day. So let's get started. I think the biggest thing to consider here is what are your goals? We're going to talk about that a lot as we work through the various areas of this theme. We'll have a lot of students ask, do they need a certain degree to be in our program at the Institute for Functional Nursing? And the answer is no. We require that you're a registered nurse or a nurse practitioner. And the thing that kind of comes up often is like, will it change my career much if I get a different degree? Or can I change jobs if I get a different degree? Or what will this do for my current practice? So every nurse or nurse practitioner that asks me this is coming from a different place. A lot of them are still working in an allopathic setting frequently. Many of them are thinking about shifting to a more functional practice or trying to figure out what training would get them most qualified for that. I think it's a really relevant question. There isn't a right answer. I find that every time that I have this conversation with somebody, it really is personalized. Often my response to them as a unique individual is that I'm not going to be able to answer the question for them. I've had a lot of nurses come into training in functional nursing thinking they want to be a nurse practitioner and that they need to go back to school. And then they learn the functional approach and they're like, oh, this is what I really wanted. And I don't know that I really need to go back to school to become a nurse practitioner. I was looking for this. And I have mentioned in past episodes that my experience was that I went to NP school hoping to offer something different. And in reality, when I finally found the functional approach, that's when I was like, this is what I've been looking for. So I could definitely relate to that feeling. And I've heard that from many, many nurses. Then on the other end of the spectrum, I'll have nurse practitioners that are already nurse practitioners tell me, oh gosh, I wish I'd known about functional medicine before I went to NP school and wasted all that money because this is what I was really looking for. And that doesn't mean that that's like the case for everybody. Many of my students are really grateful that they are a nurse practitioner and that they can do things like prescribe when needed, be a primary care provider, offer lab work easily and bill through insurance. So there's certainly benefits in that regard. I've done an episode before on whether a registered nurse needs to become a nurse practitioner to practice functional nursing. So you can go back and listen to that one where I kind of talk more about those two roles separately. But first, just thinking about the various degrees and what we really want to consider. We want to think about the fact that it takes a lot of time. I'm in my MBA program right now while building IFN, and I'm really happy that I'm doing it, but it definitely puts a strain on my schedule to be back in school. It costs money to go back to schools. It's definitely an investment. Some of my students figure out, even for attending the functional nursing program with us, that they'll have reimbursement through their employer because it's continuing education. So that's certainly the case if you're going back to a university as well, that potentially your employer may be reimbursing tuition. So money may be less of a consideration, but for most people, it really is high on the list of things to factor in. Some of these advancements in degree could lead to an increase in your scope of practice and being able to offer more, such as becoming a nurse practitioner or a midwife or a nurse anesthetist, where the degree is actually broadening your scope. But a lot of the time, like getting a master's degree in nursing isn't really changing your scope of practice. It's more changing your knowledge base and what you can offer in the future. So it can offer a lot of career flexibility to advance your degree. It sometimes can increase your income. If you have a master's in nursing and you are listening, you may be chuckling to that because I know a lot of my students that have gone back and gotten degrees to become nurse educators or leadership roles may have found that they took a pay cut, or like in my experience, like hearing how much registered nurses can potentially make now just entering the field and maybe doing travel nursing or working overtime versus spending that time in school compared to when I entered the field, it's just kind of mind blowing. So it doesn't always mean that you're going to make more money if you get another degree, but often it can. The thing that for me personally, and that for many, many of my students, that is the most important consideration is aligning with our values and feeling like we can practice in a way that is more aligned with what we want to offer our patients. I think that is one of the biggest things that calls nurses to the functional nursing, functional medicine world is wanting to offer something better and to feel better about our work and to have better answers for our patients. And so alignment with your values is high on the list of things to consider as a reason to go back to school or not. But more education in itself doesn't mean that you're going to feel more fulfilled in your role or that your role is even going to change. It really depends on the degree that you're choosing. When we're talking about associate's degree to bachelor's degree, that was the path that I took. I went to my local college, I got an associate's degree in nursing, and then went on to get my BSN, MSN, and then DNP. The thing that I always think of when somebody questions whether they should go back to school or not is that phrase, you don't know what you don't know. And I definitely have learned to embrace that in my career. And I think the first time that I really, really understood that was going back for my bachelor's degree, because as an associate degree nurse, I was working in critical care. I was a go to on the units that I worked on for support with a lot of my peers, training and precepting other nurses. I felt like my skill set was really strong and wasn't aware of what benefit a bachelor's degree would offer me. But I did know that I didn't want to be in the bedside role for my entire career. So I knew that at some point I was going to need a bachelor's as at least a stepping stone to what I decided to do next. I did go back to get my BSN. When I did that, taking the classes there, a lot of students tell me, and a lot of my friends that are nurses, that they're going to go back to school for a bachelor's degree simply because it's the requirement for them to go to NP school or get a master's or doctorate. But the bachelor's itself, I remember taking a research class for my bachelor's degree and just realizing like the different ways that you could look at research. We didn't talk about research that much in our associate degree program. It was definitely more skill, technical, and like the know-how and pathophysiology, pharmacology, like all those things. It was less about the total holistic approach. And so research and the holistic approach were things that were heavier content in the bachelor's program, a lot more writing papers and a lot less of taking a bunch of really stressful tests was my experience there. It was more about the theory behind nursing and community themes for caring for patients and working upstream. Some of the themes that align with the functional approach were more heavy content in that program and less something I had learned in my associate's degree program. For my bachelor's, it was getting me to the next step, but it was the first time that I questioned, like, do I really need this? And how's it going to make me a better nurse? And then taking those courses, I was able to see like, there are different ways to look at a lot of the approaches. I remember being a brand new nurse and I worked on a med surg unit that I would frequently get patients that were going through alcohol withdrawal. I noticed that there wasn't really a clear way to care for them. I went to a physician that I knew cared about that patient population. We decided to come up with a protocol for how people that were going through withdrawal would be managed in our hospital. And it ended up coming to fruition and being successful. We had have other people on the team for it to be built, like pharmacy, but it was really exciting to be a part of that. But I remember going to the very first meeting. So I only had an associate's degree, but I really wanted to like improve care for my patients. I sat down in a meeting with a gal that was working on her doctorate as a nurse, and she was an educator in the hospital. She was in our meeting to talk about how we were going to develop this protocol. And the first thing she asked me was for the research and evidence that was going to inform the protocol. To me, with an associate's degree, I was like, no, like, I don't know what you mean. Obviously, we need to do something different. Things aren't working well here. We have a lot of patients struggling and going through withdrawal unsafely. Like, we need to do something different and have a uniform approach to that. But I couldn't really understand that I didn't just need to say we have a problem. I needed to have some information to inform how we were going to approach it and what was the best methods. That for me, going and getting my bachelor's was when I really understood how we look at things differently when it isn't just about the technical and clinical practice and it's more about informing practice. So that's what I would say about getting my bachelor's. And I think for a lot of you, you either already have a bachelor's or you're past that part, but I did want to touch on it for those of you that are earlier in your education. When we talk about the BSN to MSN, that's where I did my family nurse practitioner training. That was really focused on diagnosing, prescribing. It did expand my scope of practice. That would be the case as well if you were going to become a nurse midwife or nurse anesthetist. A lot of master's programs for these types of practices have transitioned, like in my state. It's difficult to find a program that offers a master's because Washington State was trying to make it where every nurse practitioner had a doctorate. They had all the universities transition to doctorate programs. And in my state, that is the big focus is on doctorally prepared nurse practitioners. But you can still do programs that are masters in various ways, and they're available throughout the country and I'm sure the world. I haven't researched that. For nurse practitioner, nurse midwife, nurse anesthetist, it is expanding your scope to do that. It's going to change probably your practice completely. Like you might go from working at the bedside or working in an inpatient setting to maybe being a primary care provider or working in a specialty practice. The other types of master's degrees you might choose to get may not expand your scope. Becoming a nurse educator may be a master's track that someone chooses to go down. And so that could be the first tier. Often employers will require either a master's or a doctorate, depending on the position, to become nursing faculty. And now a quick word about our sponsor, the Institute for Functional Nursing. IFN is the leading education and community platform for nurses bringing functional medicine into their practice. IFN offers everything from short, on-demand contact hour courses to the full functional nursing program, designed specifically for nurses and nurse practitioners ready to practice root cause, whole person care. If you're looking for connection and real-time learning, the Functional Nursing membership includes 4 live meetings every month where we cover case studies and have open discussions and connection. Come be a part of a movement that's redefining what it means to be a nurse. Visit fxnursing.com to learn more and join us. And now back to today's episode. So this would give nurses the opportunity to teach in an academic role, but it isn't changing their nursing scope of practice or their licensure. It is really good for nurses that love to educate and mentor other nurses. And I think the benefits of becoming a nurse educator are pretty clear. Another master's that is frequently gotten by nurses and nurse practitioners, if they're going to go back to school, is for like a leadership or administrative role in nursing. This is more if you want to try to change the system and improve a setting like a hospital system, or work in a leadership role either in a clinic or an allopathic setting like a hospital or a chain of clinics, for example. I've had friends in leadership roles that oversee several departments. Maybe that in itself is different steps, maybe stepping away from clinical practice and working with patients directly, but instead influencing the broader system that we all work under. And that can definitely touch patient care as well. The one that I think I get the most questions about is, if you're going to get a doctorate, which one do you want? And so I wanted to kind of make a distinction between the two. First, I'll kind of tell you what I did. So I had my MSN and I had been practicing for several years and realized I wanted to get my doctorate. I was teaching at my local college and realized that I would need a doctorate if I wanted to continue to do that in advance or step more into my role that I'm in now as an educator in its own right. But I definitely tried to do the research to figure out if DNP or PhD would be better suited for me. And I chose the DNP route. I think that it is confusing for a lot of nurses that are considering getting a doctorate, whether they would want one or the other. If you are going to school for a PhD, I think most of us are pretty aware with the idea of a PhD. Both a DNP and a PhD are terminal degrees, but is the highest tier that we can get in any profession. And for a PhD, it is a lot about working in research or academia, generating new knowledge that informs clinical practice. The PhD is really focused on performing research that is going to inform practice, but isn't necessarily about practice. That's kind of the difference. DNP, a doctorate of nursing practice, if you really think about that term, that it's a doctorate in the practice of nursing. The DNP is really more about clinical practice. You do definitely learn leadership skills and how to improve the system, but you are really focused on doing it in a clinical setting. For example, a lot of my work in my DNP was focused on PPI use reduction and patient and provider education around that and improving the systems that whole like the idea of patients getting prescribed PPIs. Are they having discussions with their provider about the risks and benefits, alternatives, weaning off of it in a safe and effective way, and just like evaluating provider confidence in having those conversations, offering something as a solution to the fact that there are challenges there and evaluating that whole system. So it was about finding a problem in a clinical setting, doing research to figure out what would be the best solutions, and then implementing some of those ideas, and then evaluating the process, refining things, and seeing if it improved the system. I did that in a GI practice that had 6 to 8 providers. It kind of fluctuated through my doctorate time, but just evaluating how the providers felt about, like, doing evaluations with them about, like, how often are you having these conversations? How often are you considering patients for a weaning protocol? How often are you using weaning as a strategy for getting patients off PPIs? What are the barriers to you doing that with your patients? What would facilitate that more? And then also realizing that education takes time and offering some digital options for patients so the providers don't feel like there's a huge burden on them one-on-one in visits in this case, and then also evaluating afterwards to see how effective some provider education and options for patient education were in getting providers to more frequently have those conversations and consider patients for PPI weaning and cessation and supporting them with other alternatives as well. So that just kind of painting the picture of like that was most of my doctorate work was on that idea of like finding better solutions and evaluating how it fits in an existing setting. And I often talk about like, I really want to do an episode on nurses participating more in research. And most of these degrees that we're talking about require you to do several projects or research activities. Or in this example, like getting a DNP, this evolves over several years where you work on a particular theme. And these are opportunities for us as nurses to work in supporting research that validates our practice and informs our practice moving forward, improves the clinical settings where we're working. I've talked about my hospital system before and how we got bought out and all that. Before all that, travel nurses would just come and they'd tell us how great our hospital was. And I feel really lucky to have worked there at the time. And our leadership was really great at allowing us as nurses to do exactly what I just talked about, to during a degree program to do like a pilot study on one unit and evaluate how that went and maybe adapt it and then implement it hospital wide. For example, me helping to establish the alcohol withdrawal protocol for the hospital. Like probably still exists. It still existed the last time I was there. And that was something that I worked on in 2009. Is still having effects in the hospital. I'm assuming because I haven't been there in a few years, but the the things that we can do in nursing that we aren't already, you can work on schoolwork, but it can also help to improve the setting where you work and possibly impact care for patients for years to come. That is an additional benefit that I wanted to mention while we're talking about what is a DNP versus a PhD is like by doing this and working on your degrees and doing projects or research during that time, you can really improve things in your setting or in community settings A lot of my peers, when I did my DNP, were working in local schools or community centers. There were a lot of different settings that they could choose to do their work in. It isn't limited to just clinics and hospitals. PhD compared to DNP. So, DNP, I hope by me sharing my example, you can see where that is really about finding a problem in a clinical setting and doing the research to identify potential solutions. This is a hypothesis, right? So then you want to implement it and refine it and maybe disseminate it further if it is a really effective strategy, or learn from it and have it inform practice. The PhD, alternatively, is not about the clinical setting and doing it in clinical practice. It is more the type of research that we think about all the time, where it's like a trial of having patients take this particular medication versus this other medication, or this medication versus none, or doing one intervention to one group and then having a control and evaluating the outcomes based on that. That's classic research that we think of when we're thinking about research. So they're different. Some programs, if you want to be an educator, prefer a PhD over a DNP. That really depends on the school and the program, but that is a consideration as well. I think the biggest thing, like I said, that you don't know what you don't know. Each time that I have decided to go back to, you don't really know what you're in for. When you learn new skills, it's like you have this new awareness and you realize how ignorant you were about a particular topic in the past. And I've definitely learned a ton about research and evaluating research and how it can inform practice. And that's one of the reasons I definitely need to do an episode soon on that topic. But I hope that this kind of gave you an idea of the different choices and what you might decide to do with your practice. I think the bigger question is, do you really need another degree? Because as I touched on earlier, a lot of nurses think they want to go back to school specifically because they're unhappy in their practice and they want to do something different. And I think we've been taught that the next step is always more school, but I don't think that's always true. I really encourage you to reflect on what it is that you're really looking for if you're thinking about going back to school. There are alternatives. Obviously, you can do something like what I have mentioned for me and my students is learning the functional approach, doing that type of training and offering it in your current setting, changing settings, entrepreneurship. A lot of my students are entrepreneurs, building their own practice and practicing in a way that aligns more with their values. I think for many nurses, that's actually what is lacking, is feeling fulfilled in the role you're in. And that doesn't necessarily mean you need to go back to school to feel better about what you offer. I think some of the biggest transformations I see in nursing doesn't really come from another degree. It's from learning how to practice differently than we do at the time that we're feeling really burned out. And I remember working in the hospital and newer nurses coming to me and asking about going back to school. And I would tell them, as far as their bachelor's, I'm like, just do it before you're burned out. Like, get it over with, because when you figure out what you want to do, you'll at least have that over with, and you're going to have to do that to move forward in pretty much any path that we've discussed. So if you're thinking about getting your bachelor's but not sure yet, and someday you want to do something different, get the bachelor's over with. It definitely, I think, is something that's doable for people working and doing it on the side, and you can take your time. I don't think that it was particularly demanding compared to all the other programs I've done. I think really think about what do you want your day to day to look like long term when you're deciding whether you should go back to school or do a training program or something, is what is your actual goal? Maybe take the time to journal on that or reflect on it. I don't think it's something to rush. I've met people that tell me oh, I went back to school for this and halfway through I stopped. I think making it an informed decision so you really know that it's what you're called to do, and not just everybody else is becoming a nurse practitioner that's burned out in my clinical setting, so I'm going to do it too. Think about what you would like your service and your career to look like in the future and what would get you there. And maybe it is another degree, maybe it's not. Thinking about if it's going to expand your scope and if that's what your goal is, or if you're looking for a title change, like becoming a nurse educator, then maybe expanding your scope isn't your goal and it's more about developing the skills as a nurse educator, which I do think is a really important skill. I think that all of us tend to become really skilled in training, being able to educate our own patients, But thinking formally about education for nurses, it is definitely a skill set, even though it doesn't expand your scope of practice in the clinical setting to become a nurse educator and get a master's in that. It definitely does change how you view education and how we educate our patients as well. Does your thoughts on what you might do next align with how you want to care for patients in the future? Choosing, I think, just don't choose your next step based on what you think you should do or what others are doing around you, but choose it based on where you're really trying to go and what you envision your future to look like. I think it's okay if you don't have this all figured out yet. I don't think it's something to rush. It's kind of like I talk to my entrepreneur students about like thinking about the name that you want for your business or what your niche might be in functional nursing. And it's like, please don't force yourself to make a decision, let it unfold in time because, most of the decisions that I've made that were really important, the decision I would have made the first day it occurred to me to make the choice is completely different than what it was when I let it unfold naturally over time. I think recognizing that like calling to do something different or consider another program or degree is that stirring in us. I'm really big on like the idea of dharma and like why we're here and how we spend our time on earth and like what are we doing for society. So I think like thinking about what you want that to be for you and what you want to offer the world, what you want your day to day to be, all of that can really help to inform what you decide when you're thinking about going back to school. And I hope that this episode was informative for those of you that have been kind of on the fence about what to do next in your career. And until next time, be well. Thank you for tuning in to the Functional Nurse Podcast. If today's episode resonated with you, be sure to subscribe and leave a review. It helps other nurses find this movement. To learn more about our programs and join the community at IFN, visit fxnursing.com. Together, we're not just rethinking healthcare, we are rebuilding it from the inside out.